Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Today's topic is whiplash. Whiplash injuries are a major public health problem. Not only do they cause significant pain and time off from work and leisure activities, but there's also a general effect on quality of life. A study in the European Spine Journal compared female patients with whiplash of the neck to patients with low back pain and another group with rheumatoid arthritis, and researchers looked at pain levels, how high or how low, for example, and how quality of life was affected, and the pain levels were the highest among those in the whiplash group. Those in the whiplash group also experienced the greatest overall impact on their overall health, with noted disturbances in social issues, vitality, emotional, and also mental well-being. In a study in the journal Spine, they looked at how medical and chiropractic doctors differed in their approaches to patients with whiplash. MDs were more likely to have negative feelings about treating patients who have whiplash. They were also more likely to believe that there was nothing physically wrong with many patients with chronic whiplash. In terms of treatment, most medical doctors believed that non-steroidal anti-inflammatory drugs and muscle relaxants were effective for those with acute whiplash, despite the significant scientific evidence of problems of safety with long-term consumption of these drugs, like stomach bleeding, for example. In addition to questions of safety, there's virtually no evidence that these types of medications actually improve patients' pain or overall quality of life as well. Chiropractic approach to whiplash is much different. First, there's a general acceptance that the injuries are real and not made up. Biomechanical studies of auto accidents confirm that these injuries are real and mostly consist of sprains to the joints of the neck, and the spinal ligaments, muscles, and discs are all affected in whiplash injury. When trauma to these tissues occurs, the sensitive nerves that go between these structures are also irritated, and this results in pain and changes in balance, like dizziness and position sense. Over time, the patient may have significant effects on their quality of life. So, one study of chiropractic care in the journal Injury also looked at the results in patients with chronic whiplash injuries, which occurs in about 43% of cases, and 28 patients were studied. And of these, 93% had improved following chiropractic treatment, had gotten great improvement with it. So, if you yourself have whiplash or know of anybody who does, we'll be happy to check them at New Hope Chiropractic. Have a